The risk factor of stroke, if you look at, are usually divided into groups. The first group we call modifiable risk factor, that's the risk factor that we can modify. The second group we call non-modifiable risk factor. The modified risk factor is something that we see every day. People who have high blood pressure, people who have diabetes, high cholesterol, smoking, sedentary lifestyle. Those are the risk factors of stroke that we can modify. There are two strong risk factors that we cannot modify, or probably three. Number one is there are certain family member predispose them to have stroke. There are certain disease genetically determined that they have higher risk of stroke. For example, people who have certain type of connective tissue disorder, they have higher risk of bleeding stroke, as well as have higher risk of tearing apart of the artery. For example, Marfan syndrome, M-A-R-F-A-N, Marfan syndrome. These people, the artery wall is very fragile and it either rupture or tear apart easily. Genetically is one thing that people cannot modify. Second thing is gender and aging. I mean, obviously, male have higher risk of stroke compared with female, essentially because of female hormone does show some degree of protection. What I'm trying to tell you, if you're looking at someone who have male and female who have the same risk factor, the male obviously have a bit higher because of they have not have so-called protection naturally from the hormone. The third thing is aging. I mean, stroke, given to the fact that the stroke is the problem with the piping, either it rupture or it's narrow. You use the pipe for 40 years, 50 years, 60 years. Obviously, the pipe get rotten, the pipe get narrow. Those are risk factors that we cannot manipulate. In general, in medical field, we try to manipulate the risk factor that we can modify. For example, a guy who have high blood pressure, we need to get the blood pressure down to a certain number, depend on the disease. For example, in non-diabetic patient, we want the number below 140 over 90 millimeter mercury. In diabetic patient, we want it to be lower than 135 over 85. In a certain group who have abnormal cholesterol, particularly bad cholesterol, LDL, we want the number to be close to 100 or lower than 100 is better than leave the number sky high. Diabetic, there are some parameters that we want to look at how well the diabetic control. We look at the accumulate level of sugar. There's a term, or there's some laboratory testing that we look for. We call hemoglobin A1C. Those kind of stuff, it reflects how well the sugar controlled in that group of patients. So if you can manipulate this thing, it will be good. Obviously, some other thing that you cannot measure directly. For example, smoking. Obviously, if you can stop it, will be great. It damages the vessel much less. Sedentary lifestyle. If you exercise, it gives you a lot of ripple beneficial effect to decrease risk of stroke.